Well, welcome back, everyone. Joining us today is Debra Moore, certified nurse, midwife, and women's health nurse practitioner with Lima Memorial Hospital, OBGYN. And she's going to share important information on in-office breast exams and breast cancer prevention. So thanks so much for joining us, Debra.
Thanks for having me.
All right, so with so much emphasis on self-exams and mammograms, like where does the in-office exam fit into a person's overall breast health routine?
Right, so women a lot of times will come to their wellness visits starting at age 20. It can go up to age 65. We typically like to include the clinical breast exam with that age group and even older than 65. A lot of times I will teach younger women how to do self-breast exams, but the clinical exam is something that we like to include in women's health on a yearly basis, but it also depends on somebody's risk factors.
Right. So what should someone expect maybe during an in-office breast exam? Are there any specific things healthcare providers are looking for?
Yes. So here I have somebody, typically we have them lay down. They have a gown and a blanket. Normally I ask a woman if she's noticed anything that has changed over the past year. Is there anything concerning? I also ask, have they checked their breast? Typically it's not a breast exam that they need to do every month, but just being breast aware, just knowing what their normal is. So I typically will uncover one breast at a time, and then we just are doing small circles with the flats of our fingers. And I'm feeling for tissue that might be abnormal to the surrounding tissue. So it might be bumpy. Typically, sometimes cysts are soft and can be tender. So I'm just kind of talking to the patient, asking them, have they noticed anything changing? Is, your breast tissue typically is similar on both sides. So if I feel something on one side, I will ask, hey, let's check the other side in the same area. So that's kind of like the overall what we're looking for. And we're also looking at skin changes, nipple changes, anything that's different than their prior exam.
Right. Now, for women that may be anxious or maybe even uncomfortable about getting an in-office exam, what kind of things can they expect? Or is there anything to be not nervous about?
We do our best. We know that this is a very intimate thing, and so we do our best to try to keep their mind off of what we're actually doing, and we talk about their day and how their family's doing. So it really isn't scary, and it's best, for women, their health starts with them, and, getting to the screenings, get the mammograms, coming to their clinical exam every year. That's the most important, and we do our best to make them comfortable.
Yeah, and it is very important as well. So before we wrap up, what final advice would you give to women regarding breast cancer prevention and their overall health?
Yeah, I think for women, it's, again, just being your own advocate, getting the mammogram. I know it's hard for women. They have families that they're running, or they're taking care of other people, but I use my birthday month as a time to remind me I need to get my mammogram. So that's a good thing. And then also just take care of yourself, eat healthy, try to quit smoking if you smoke, exercise, just take overall better care of yourself.
All right. Well, Debra, I want to appreciate you coming on today.
Thank you.
All right. Well, don't go away because we have more when we return.